Hello everyone, Dr. Smith, physical therapist here. Today I'm starting a new series entitled The Lies PT School Told You or Sold You. Today I'm covering my first topic, which is, does your documentation really matter? Not really. It only matters for two reasons, and I'm going to break that down in this video. Before I get into that, please hit the like button below. Please subscribe to the channel. Make sure you turn on notifications so you do not miss out on any new content. And as always, if you have any questions, comments, complaints, or concerns as the video moves along, please comment below. Now, I know many of you are student physical therapists, practicing physical therapists, pre-physical therapists, or rehab professionals in general, and you're like, what the hell is he talking about? My documentation doesn't matter. I had to learn SOAP notes. It was on my CPI, blah, 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 blah. Realistically, there's only two reasons that it matters. The number one reason it matters is if you work in insurance-based care, it's to show the insurance company why they should pay you. But that's it. Nothing else matters in that situation. And unfortunately, who's reviewing your notes? Dino-ass PTs that don't know what more advanced exercises are. So you could be the best therapist doing blood flow restriction, doing the best advanced exercises with your patients, doing dry needling, all these things, but the insurance company is not going to pay you unless you document at a lower level than what you actually did most of the time. And at the same time, I think it's kind of just dumb that you have to show somebody else what you do when you hold a doctorate. You went to PT school, you passed your boards, but they're still not going to pay you unless you write up some bullshit on paper that's usually some cookie cutter thing that they want to see because they're a dyno PT and the insurance adjusters are basically making you work for them and not for your patients. And it's frustrating, and again, that's why I do not recommend that people take full-time jobs in outpatient. If they're going to do outpatient, do travel or cash pay. Look at my video on how to get paid well as an outpatient therapist. And we see this in other settings too. But that's going to bring me to the second reason. But realistically, does your documentation matter like it does in PT school? Should you do it if you're going to be a cash pay therapist and be as detailed? No, because you're in charge of yourself. You charge your own rate. And if you're doing wellness, I wouldn't even document because that way it's going to show that you weren't doing therapy and it's going to waive your legal liability. But that's another topic for another video. Realize that schools are teaching you to work for insurance companies and it's a scam, and I recommend that you get a job where you can make as much money as you possibly can to rack up capital, to then quit, start your own practice, do your own thing, but do not become a pawn to insurance companies and forget about treating patients because you have to document a certain way, or if you get yelled at as a student because your professor's like, oh, this is wrong, or your CI, when they're doing your CPI, realize it doesn't actually matter because they are a dyno pawn in a dyno system. I hope that first point made sense. Again, I'm telling you, schools teach this, everyone pushes it on you, but really it's a ploy by insurance companies that want you to show them why they should pay you when you have a doctorate and a license. And at the same time, which is bullshit and why I hate insurance companies, is that they dictate your care. I'll actually go into this in a separate video later on why standard OP is a terrible business model for PTs, but that's for a later video. But we'll get into the second reason why your documentation may matter. The second reason your documentation matters is if you are in a lawsuit, it needs to show whether you saw or did not see the patient, but your notes don't actually fucking matter when it comes to the legal system. Because what's gonna happen is, again, it doesn't matter what you say in the note. PTs usually don't do invasive procedures. In case you pop a lung during dry needling or something like that, they may actually look into it, but at the same time, again, it doesn't matter. Defensible documentation. That's not how it fucking works. I know that PT schools teach you that, scare you into that. Everyone scares you into that. Your supervisors, CIs, all of that. Defensible documentation. No, that's not how it works. What would happen for you to be involved in a lawsuit, it's not going to depend on your note. They're going to actually have to bring in an expert witness, which is someone with your credentials who can testify to a jury, a judge, court, etc., that what you did was so below the standard of care that nobody else with a license currently would have done the same thing. Again, that's going to be very hard, and the documentation isn't going to be involved in that. It's going to be an expert witness that the plaintiff or even the defense can provide. So again, they're scaring you into documentation matters. Realistically, schools are teaching you how to be a pawn in an insurance-based world. Insurance companies are teaching you how to just do extra work for no reason when they should just pay you for your services anyway, which is why I recommend cash pay and hope that everyone can opt out of Medicare eventually. And secondly, when it comes to defensible documentation, it's not what everyone thinks. People don't understand how laws work. And some bonus content for this video that people have asked me are, what do I do if I get in trouble at work? And I'm going to go into that here for a second. I actually wasn't going to talk about it here, but I'll add it to this video. If you get in trouble at work and everybody saw you do it, just admit to it, accept responsibility. If you get accused of something, you didn't do it, deny the shit out of it. If you did do something, but there's no proof you did it, deny the shit out of it, because by denying it, there's no proof that you had wrongful intent or acted wrongfully. Anyway, I hope this video was helpful. I'm Dr. Smith, physical therapist. Please subscribe to the channel, and I'll see you in the next video. Thank you.